Gary Bellman. I'd like to talk about misconceptions of the thickness of the blood on men on testosterone replacement TRT. A lot of misconceptions and a lot of comments and questions that I'd like to address and I'd like to clarify. Why are we concerned about thickness of the blood? Theoretically concerned that if someone goes on testosterone and their blood gets too thick, theoretically they could be a risk for a clot, a stroke, a heart attack. I think the risks are very, very small. It can potentially affect blood pressure, and some men, when their blood gets too thick, they don't feel well. So in an abundance of caution, as men who are on testosterone for years and years, we want to make sure it's safe. Fortunately, the majority of men on testosterone, their blood doesn't get too thick, and sometimes the hemoglobin rises 17.5, even 18. It's not too thick. Only if it gets to a high level do you have to take off some blood. Now, I'm on social media to share my experience over 30 years with thousands of men on testosterone. Now, I respect individuals' personal experience, and some people have posted that they do this and their blood pressure is better, or they do that and the thickness of the blood is better, and they take this supplement and things are better, and they advocate it, and that's a single experience. Now, while it's impactful for the individual and maybe other people that they know, it doesn't represent the majority of people. And so while I'm not trying to invalidate people's experiences and feelings, I'm trying to educate people and tell them what I think is true and not true. So 4 misconceptions of testosterone and thickness of the blood. The number one is the frequency of injections. You inject once a week, twice a week, or 3 times a week, has no impact on the thickness of the blood. Some people think that they inject or pin 3 times a week and that prevents the thickness of the blood. That's absolutely not true. The way testosterone causes thickness of the blood, it stimulates erythropoiesis. It stimulates the erythropoietin production. Essentially, it stimulates the bone marrow to make more blood. So it doesn't matter if you inject once a week and the bolus is higher or multiple times. I've even had patients who are on topical testosterone, which doesn't reach high levels, have thickness of the blood. The only reason to inject more frequently is to smooth out your levels and feel better. And some men feel better, myself included, on 2 shots a week. But the number of times that you inject will not impact the thickness of the blood. So some people say they pin 3 times and their blood is fine. That individual might be fine with once a week. Misconception number